Thank you so much for coming back from the break. We're going to get started with our next talk today. Is a panel discussion on community resources, and moderating our panel is Dr. Ken Epstein, who will be introducing the rest of the panelists today.
Thank you. Wow, I hadn't seen that video, so I'm moving slower. Thank you. We have an incredible opportunity today. I just want to first, before I introduce the panelists, say a couple of things that introduce the panelists. This gathering today, Joan and Petra, it feels like you've almost spent hundreds of hours putting it together and sleepless nights, but I know because it's the story that's being told today is quite incredible. We learned about why ACEs, the research, the workflow, the context, including centering inequities and racism, organizational and culture change, vicarious trauma and resilience. And then we had this incredible role model, role play, where we got to see how it looks in action. And then the early adopters just really brought it home about like, how do you do this work? And it's a natural progression now to have the folks that are going to talk to you now, because it shouldn't be first we be talking about who you refer to and how to do the system of care. It should be first how you build the relationships so that maybe people will use the system of care. And we know in history that when we give people a referral, the likelihood that they'll go to it is quite low unless there's a connection to the person who's making the referral. And I think so much of today has been about how we get there. And so I appreciate it. I want to introduce our panel. We use the word system of care, and I think you really have some great panelists. We have Lauren Farrar, who's a senior program administrator with First Five, and she oversees the implementation of Help Me Grow and promotes early identification and intervention and connection to services. And she'll talk more about First Five. Dr. Malcolm Gaines, clinical psychologist and currently serves as the Senior Clinical Projects Director at Safe and Sound. His work focuses on strengthening protective factors in families and communities. I'm going to hear a lot more about protective factors and integrating trauma-informed principles into every level of the organization. And Artanisha Jackson, she's a clinical social worker with over 16 years of experience, direct experience. She currently serves as a manager for the Find Connect, which we heard from Dr. Long at UCSF and Benioff Children's Hospital. Julianne Rositas is the program manager for the Family Paths and Parent Education, Fatherhood and Foster Parent Community Advocate Programs. That's a mouthful, and you'll hear more about why it is. She has over 20 years experience working with parents, caregivers, and families, and holds multiple evidence-based parenting training certificates. Dr. Kimberly Seng is a child and adolescent psychiatrist with the San Francisco Department of Public Health and Community Behavioral Health Services, a place I got to work with her and see her work, incredible work. She's currently the medical director of Chinatown Child Development Center and one of the community outpatient mental health clinics serving youth and families in San Francisco. And finally, Teresa Segarra is the interim director of First Five San Francisco. I hate to use the word interim, Teresa, because you're like, you're central to it and you've been there before, but I'm just going to use it for this purpose. You're the director, where she guides First Five's mission to improve outcomes of the city's youngest children and their families. She's worked throughout the Bay Area for nearly 2 decades in the nonprofit and public sectors. I just wanted to say a quick word about the system of care. You probably know, if you don't know already, from my 30-something years in the system, that it's complex. It's built in silos. The funding is built in silos, and it's very difficult to navigate. And so if you're experiencing that, it is. The folks today are going to talk to us really about how to navigate their systems, but they're really going to talk to us about how to navigate the system and ways to maybe facilitate faster and more efficient and better connections to our families. With that, I just want to turn to the panel members and really ask you all to, I've said some about your name and role in the organizations, but can you describe more detail the services that you provide to families? Focus on really the kinds of ways in which access can be attended to. And I'll just call on you and we'll go through each of you so we can get to everybody. Is that okay? Okay, so uh, since you gave the thumbs up, I saw you, Artanisha. How about if I start with you? Are you okay with starting?
Not a problem.
All right.
It's still morning. Good morning, everyone. Thanks for being here on this Saturday with us. My name is Artanisha Jackson. I am a clinical social worker and the program manager for Find Connect at Children's Hospital Oakland. And just a little bit about what Find Connect is essentially it's a technology tool that we use to build capacity to support families with getting connected to community resources to meet basic needs. So that could be food needs, housing, utilities, activities for children, a number of things. And so this technology tool, Find Connect, we have navigators that support families both virtually and in person. And they use Find Connect to screen families for social determinants of health, ACEs, and other things depending on the workflow. But our workflow in primary care and our FQHC is that they're screening for mental health needs, they're screening for safety concerns, a number of things. And then once we screen families and we are able to identify what those needs are, we can connect them to the resources that already exist in the community. What's unique about Find Connect is that we vet those resources. We take an extra step to vet those resources to make sure that where we're sending our families, that they're receiving, they actually exist, they're receiving the support that they need, and they can ask for someone by name. And so that's essentially what Find Connect is. And I'll explain more when we get to the questions.
We'll get to it. And you're located I know you're located in Oakland, is that correct?
Yes, we're at Children's Hospital Oakland. But Find Connect itself is a technology tool that could be licensed and used at other clinics and community settings. And so that's something, if you have questions about how you could use Find Connect in your clinic, I can answer those questions as well.
Thank you so much. So now we're going to go to our, we'll just go by, sort of youngest in service area, not in age and anything else, but yeah, in who they serve. And want to go to our first 5 or 0 to 5 for our babies. And Teresa, I know you were going to start us off with a description of first 5, and then we'll go to Lauren after you.
Okay, great. Good morning, everyone. So yes, Ken introduced me. I'll just repeat my name so everyone can have that for reference. Teresa Zagara with First 5 San Francisco, and wanted to give you a brief overview of First 5s. There is one of us in every county. We're funded with Prop 10 tobacco tax dollars to develop and oversee programs specifically for families and children in the birth to 5 age group. But you also, those of you who have interacted with different First 5s might have noticed that First 5s do vary. We do differ in terms of scope and size, also the degree to which we might operate and operate services directly through our staff or through our offices versus playing more of a funder or backbone role. But what all First 5s have in common is our work in 4 focus areas. We work in child health, family support, early care and education, and systems change. First 5 San Francisco primarily acts as a funder of programs. We don't operate programs ourselves, but we do fund 3 main initiatives in San Francisco, one of which is our Family Resource Center initiative. That's a network of 26 family support programs that are blanketed throughout the city. These family resource centers offer a standard set of core services. So if you're going to one of First 5 city-funded family resource centers, you'll find a standard set of services that run a continuum from prevention to early intervention to more trauma-based or therapeutic support services. Also, right now, our family resource centers, we have half of our family resource centers that are operating weekly food banks and diaper bank services. So that's important to note. And those have actually, in the past several months, they have doubled and even tripled in size to respond to the COVID-19 crisis and basic needs. We also fund a Help Me Grow initiative, which is an important service linkage initiative that can support connection and navigation across various service sectors. So for example, helping the families you see in your practices connect to other family support, early care and education, and early intervention programs in the community. I'll hand it off to my colleagues.
Thanks, Teresa. And later on, we'll talk about access, but I appreciate that description. And Lauren, would you take us from there in terms of your adding to this conversation?
Sure. Thank you, Ken. As was noted previously, my name is Lauren Farrar, and I'm a senior program administrator with First Five Alameda County. And it's just such a pleasure to be speaking with you all this morning. It's been such a great event so far. At First Five Alameda County, we fund a range of programs and strategies that support policy advocacy and systems change, provider and organizational capacity building, and of course, services to children and families. With regard to services to children and families, we're funding family resource centers, parenting support, parent-child activities, and navigation through our Neighborhoods Ready for School strategy, which is in Oakland and Union City primarily. In response to COVID-19, First Five Alameda County established a resilience fund, which is funding areas such as expanded food access and supply distribution, such as diapers and wipes, which have been very challenging for families to access during this time. And lastly, we provide Help Me Grow. Help Me Grow offers a central access point for families and providers to access information relating to child development, social emotional development, and well-being, and provides care coordination and navigation to connect families to a wide range of resources, which I'll address later on in the panel. I also wanted to note that through Help Me Grow, we maintain a website called alamedakids.org that provides a publicly accessible resource directory with a wide range of resources and a calendar of events such as supply distribution events for families and virtual activities like library story times, parent support groups, parent trainings, etc. And we've also created a special coronavirus resources page with vetted resources on things like talking to your kids about COVID and relieving stress, to specific resources on accessing basic necessities and resources for immigrants, for example. Thank you.
Thanks. And if we can't remember all of this, you have websites and we'll find it there, right? There's a lot of stuff. Okay, good. So let's talk to Julie about Family Paths and hear a little bit more about the work you do and where you're located.
Good morning, everyone. And I just want to say that I'm honored to be on this panel today. And I want to honor all the panelists and resources that we heard prior to this panel. Again, my name is Julie Rositas, and I'm representing Family Paths in Oakland, California. We provide a variety of mental health services. We provide therapy for children, families, as well as adults. We also provide victims of crime therapeutic services. We have a 24-hour parenting stress helpline. We also have a foster parent advice line that can connect foster parents, caregivers, and adoptive parents to a family resource community advocate or foster parent resource community advocate. Then we have parenting education, which is the programs I manage. And under the parent education program is our positive parenting program, which was designed by and for Family Paths after a 5-year field study back in 1983. Then we have our Abriendo Puertas, Opening Doors, evidence-based parenting education program, which was designed originally for and by Latino families, and it is followed by the School of Social Services out of Berkeley. They're the ones that stamp, that did all the research in order to, stamp it as evidence-based. Not only are we a provider, but we're also a train-the-trainer. As of last year, we managed to receive certification to be trained-the-trainers of this amazing practice. Since its inception, we brought it to Alameda County in 2015. We actually teach it in 5 languages now. It's been very, very receptive in all kinds of different cultures. So it's a really good program. We also have our fatherhood program, which we launched in 2017 with a grant from Greater Good Science Center out of Berkeley under their initiative, Raising Courageous Children. We actually had the privilege of designing the program. I actually led the curriculum design with a curriculum consultant out at Vanderbilt University and an evaluation consultant from Cornell University, and we came up with a really amazing 6 weeks program for fathers. And we also have our family yoga project, where we bring family yoga for parents and for parents and their children to different community libraries or schools or wherever it is they want us to come. And that's about it. Oh, one more thing. We have our Finding Peace Within program, which actually won Most Innovative Program in Oakland in 2018. And that is designed for, it's a very skills-based program. It's designed for women who have experienced trauma. And we do it twice a year. All that information is on our website. Just one little niche. I do want to say that all of our programs are really grounded in trauma-informed care, 5 protective factors, and cultural humility. So I'll say more later.
Perfect. That's a good lead in to Dr. Gaines, who I think is going to talk to us about the 5 protective factors and the work of Safe and Sound. So I'll turn it to you, Dr. Gaines, and give a little introduction.
Okay. Thanks, Ken. Thanks for moderating us today. And thank you, Joanne, for inviting Safe and Sound to be a part of this really illustrious and panel. We really appreciate it. So Safe and Sound is one of the 26 family resource centers that you heard Teresa mention in San Francisco. We have been around since the early 70s, actually. So decades of experience serving families and children in San Francisco. And really, if I were to list our services out, and I'll do a short version of that, but you would hear pretty much a very, very similar slate of services to what you heard from Family Path. We're really our sister organizations around focusing on strengthening protective factors in families. We also use the 5 protective factors model that comes from the Center for the Study of Social Policy to really think about serving families who've experienced trauma and really focusing on stabilization and strengthening families. Those first 2 phases really of trauma recovery are really how we think about most of our services and serving those functions. We also have a 24-hour parent, like Family Paths, we have a 24-hour parent support line. We provide a lot of groups and classes for parents, many of which we're doing remotely now. We sort of had to, convert just like everybody to doing that. Some evidence-based parenting classes, as well as some more sort of homegrown community need responsive kinds of classes and groups to support parents. We also offer some parent-child programs as well. And we have a lot of programs for kids too. Right now, we're doing things like kids yoga remotely, a little homework club remotely, some essentially sort of drop-in time for our kids' playroom. We also provide a substantial amount of care management and care coordination for families, really connecting them with resources. And we also provide mental health services for parents and kids. Right now, and what we found during the pandemic is that although we focus on all 5 of the protective factors and all of our services are focused on building family strengths in different ways, we really found that we needed to pivot and really focus especially on concrete needs for our families. We are one of those family resource centers that provide a food bank. When people couldn't come to our building, we delivered food to families. But now I think families can come and pick up food once a week, also diapers and hygiene needs for families. And we also have been connecting families with resources to help with rent and housing and all of these other needs. Julie, when we were talking earlier in our meeting, you mentioned, I hope you don't mind if I sort of lift this up, what you said before. You mentioned that something that a family resource center can provide is sort of a holding function for a family. We provide a lot of services already ourselves. And also if specialty mental health services are needed or some other particular service that a family has to sort of wait for, or that it takes a while to connect to, a really good a function that a family resource center can provide, particularly one that maybe has a 24-hour line or provides this kind of drop-in sort of services, is a holding function for that family until they can get to that other service, which doesn't have to stop when they get to that service. But I like that concept, Julie, and I wanted to lift that up as a way to think about what Safe and Sound and other family resource centers can do. So thanks, Ken.
Thank you so much. And I think one of the things you want to recognize about the presentations we've had so far is none of them require eligibility. These are available. And so I want you to just hear that these are not services. And you heard the words mental health, but only a little bit, right? You heard a lot of support and concrete support and sort of family and collaborative kind of services and finding services. So, and I think, Malcolm, I just wanted to highlight something you just said and then go to Dr. Sang. That in our earlier conversation, all of you said that it was your hope that wherever somebody landed, like they called, that somehow they could get help there and not be told, you know, oh, we can't help you, that there would be a way in which, and that doesn't always happen, but I want to appreciate that sort of no door is the wrong door kind of idea that is and should be central to our system. Doesn't always get practiced. Dr. Sang, you want to talk to us more about your situation where you work and what's there?
Sure. Uh, Good morning, everyone. It's a pleasure to be here. I will share with everyone a little bit more about our San Francisco Department of Public Health, Children, Youth, and Families system of care. I just want to mention that Dr. Ken Epstein used to be our director of our system of care. So he and I can answer questions regarding San Francisco Department of Public Health services. So just wanted to let everyone know that within our system of care, we have different levels of intervention depending on the needs of our clients and families. And so if you kind of imagine a pyramid, at the bottom of the pyramid, we provide early intervention, prevention, focus, efforts. And then if the family requires outpatient mental health services, we have a number of outpatient civil service clinics, along with contracted community-based organizations that can provide these outpatient services. If the client and family requires more intensive services, then we have more specialty clinics that can provide intensive case management, wraparound services. We also have comprehensive crisis services. So depending on the needs of the families, we have different agencies that can respond. And if the child is at risk for hospitalization, we do have hospital diversion program at Edgewood. And we also can link clients to inpatient psychiatric services if needed. And the highest level of care would be residential placement. And we would work with our community partners, such as the San Francisco Unified School District, Juvenile Probation Department, or Child Welfare, in terms of which level of care is most appropriate for our clients and families. And last but not least, I wanted to mention we also work with our private provider network. So there are many different providers that are able to provide to assist families with these services. So if our own civil service clinics have a wait list, then we're able to link families to our community-based organizations or to our private practice network. So there are many avenues to receive care.
Thank you. Just a couple of things that I'll add, and then we're about halfway through, so I want to get to the other questions as well. But the system works on children's Medi-Cal, which is EPSDT, and EPSDT is early periodic diagnosis, screening, and treatment. And all Medi-Cal kids are eligible to be screened. They do not need to have a diagnosis to be screened. And so whatever county you're in, children can be screened to see if they meet medical necessity. What's important to understand is that every county is a bit like its own country. So Alameda County, for example, does contracts out about 90% of its services, whereas San Francisco, it's more like 60 or 70%. So it has a more robust county clinic system. So it's important to understand your county system, and any of the people on this call probably understand the system as well. So it's also about understanding the system and the county mental health system. So I do want to thank you, Dr. Sang, and I want to ask, particularly of safe and sound and family paths. I just wanted to wonder if you could comment on how risks for child maltreatment and domestic violence can be changing during the pandemic. I'm sure everybody on the call is seeing something. So I wonder if you could quickly just name what we know and maybe name some things we don't know. And just any tips, probably most importantly, any tips for pediatricians on how to identify and intervene with family stress. So 2 parts of the question, and again, as concise as you can be. I don't know, I'll start the opposite way. Maybe I'll start with you, Dr. Gaines, first, and then go to you, Julie, second. 2 parts.
Okay. Thank you. Thanks, Ken. The way I think that we know the information that we do have about this right now is through our 24-hour talk line and paying attention to the calls that have come in from that over the last 6-7 months. And really, we're finding in particular that families are feeling more isolated, and we know that and not able to connect with other families, even the close relationships that they have, in the ways that they normally are. And that's, of course, one of sort of an early warning sign for when a family's stressed and then they're isolated, that the risk really goes up. We know that that's true. Julie, I think you had some good statistics on that, and I hope you'll give those to us when you in a minute. But that isolation, and then the sense of stress about resources, right? So families not knowing where to go, and things shutting down and resources not being available like they had been, although they're more available now, but early on, that was the worry. And so we actually had what we saw was we actually had a bit of a drop in calls and families sort of reaching out to us at first, which really worried us because it meant that we thought it meant that families, we couldn't kind of keep our eye on families and not in a surveillance kind of way, but on what their needs are. And that's changed. Families are reaching out much more now than they were before. But those are some thoughts about increasing risk during the pandemic. And in terms of tips for pediatricians, I would really go back to the 5 protective factors: parental resilience, social connections, parental knowledge of parenting, concrete needs, and the social and emotional competence of the child. And maybe think about that as a way to inquire about families' needs. In addition to doing an ACEs screen, which will point you to some historical factors. Are families isolated? How are parents feeling about parenting in this situation? Do they need more support or different support than they had before? And what are the sources of parenting stress? So asking questions of families in those domains can really help pinpoint areas of stress.
Thank you. Thank you, Dr. Gaines. I think also relative to that, and I don't want to put Dr. Lieberman on the spot, but I think she'll be talking later about some more ideas about how to apply and tips for conversations as well. So thank you. I appreciate that. Julie?
Thank you. I just want to echo everything that Dr. Gaines said. We, on our 24-hour parental stress helpline, we did experience at first a drop in calls. And then as time went on, calls went up, and now about 30% of the folks that call have to do specifically with this environment: where to find resources. I'm totally stressed out. I have nobody to talk to. Everything's around that. A huge part of that 30% is really around diapers, food, and rent. Diapers, food, and rent. A lot of stress around that. One of the things that we also found is that fathers are calling our helpline a lot more as well. We are actually a part of the Alameda County Father Friendly Principal Initiative, and we're a partner with Alameda County Fathers Corps. And in this last 2 years, we took an intentional approach to including fathers. In fact, 3 fathers on my parent education team, 3 facilitators are fathers out of that initiative. So, and we have 2 fathers on our parenting helpline. That has really been essential. And I just wanted, there is three tips that I really like to share with everybody. Number 1, as a matter of practice, let people know about our helplines in Alameda County, as well as in San Francisco County, just as a matter of practice. And I know that you'll find our information in the information that went out in that email this morning. 2, don't forget about intentionally talking about fathers, using that language that is specific to fathers. Because, well, as providers, I know that intentionally we consider fathers, but do we use the language, the narratives that we have, so that fathers feel included and welcomed to our agencies? And number 3, take care of yourselves. Because if we're not taking care of ourselves, as we've talked a lot about in this training, that's going to overflow over into how we care for our families. That's it in a nutshell.
Thank you, Julie. Go Fathers. I appreciate that. Sorry, that just came out. I couldn't help it.
I do want to just to add one little thing. We, in light of COVID, because of some of the isolation, we're going to be starting at the end of this month a drop-in, virtual for parents as well as fathers. And our father one's going to be called Pop Rocks Cafe, because dads do rock, right? So and we'll shoot out some information on that so everybody will know about it. And it will be open to everybody across the county, as well as San Francisco County as well. So
next question. I love, you got a comment that love that Pop Rocks Cafe. We all love that Pop Rocks Cafe. So the next question is going to go to the first fives and to Find Connect. If I'm a pediatrician out there, I'm not, but I might be wondering, this is all good and fine, but how do I actually connect? I've called and, I just can't do it. We need some tips about how do we get into these good services? Where do we start, given that you're, your experience? So I wonder, Lauren, if you'd be willing to start and just talk about linking children with community-based services and what kind of barriers and just some access questions. And again, briefly, and we'll see if you can build on each other.
Great, thanks, Ken. Yeah, I think one of the things we like to share with pediatricians in particular is that for children 0 to 5, which is who we serve, and I know that's a bit of a limitation, Help Me Grow can really take on that role for you in understanding the system, having those deeper conversations with families and helping them link to services. So in Alameda County, Help Me Grow is a service that pediatricians have been referring to for over 10 years. It started as a service primarily related to child development and responding to developmental screenings. But as Dr. Espinas noted in the early adopter panel, about 4 years ago, we started working together to support follow-up on ACEs screenings for Southern Alameda County Kaiser patients. In addition to that, we've received dozens of referrals from other pediatric practices, including from Dr. Rue, where ACEs and/or trauma is indicated as a primary reason for a referral. So just to give you a little bit deeper sense of what we do, when a referral is received, first off, we let the pediatricians know that we received that referral because we know many systems do not give you that information. Our highly trained staff, 2 of which were former Healthy Steps child development specialists at clinics in Alameda County, conduct a comprehensive interview with the family where they explore their needs and concerns, but also address and promote protective factors like Dr. Gaines spoke to earlier. We have the luxury of being able to take the time needed to deeply listen and talk with families. Through the interview, our staff will skillfully probe for a range of potential factors, including trauma and ACEs and its impact on the child's development and the family as a whole. We'll provide parenting and anticipatory guidance and also provide a range of options for services and referrals to help the family make an informed decision. And we'll update the pediatrician after this first conversation with the family and throughout the process. And depending on where the family or child is being referred and the family preference, we may take a more active role in facilitating the referral. For example, in Alameda County with specialty mental health, we have a special process for referring to the EPSDT agencies, or we'll provide the family with all the information they need. We continue to follow up to ensure connectivity and remove any barriers, and provide updates to pediatricians when there are significant milestones, such as connectivity to a mental health agency, for example. In terms of barriers, I think people have spoken to those already. I don't think we have any magic bullets, but we have for many, many years built those deep relationships with systems and can kind of, get through the back door, know the right person to call or the special things that families need to say. So again, just recommend in Alameda County that you might consider referring to Help Me Grow to support you with that. Some of the barriers are confusing processes and eligibility requirements, and also limited resources, as was already noted, especially in the areas of concrete resources such as diapers, rental assistance, et cetera.
Thank you, Lauren. Hey, Teresa, can you quickly maybe build on some thoughts about access? Just really, how do we get in and how do we, make the connection?
Sure, yes. And I'll say a little bit kind of specific to San Francisco too on some of those same points, but our Help Me Grow in San Francisco also functions in a very similar way as a good central navigation point for pediatricians. I think also important to know that our Help Me Grow in San Francisco is one of our funded family resource centers as well. And so if you start there, they will not only be able to have that deeper conversation, connect families, and help families navigate through GGRC, the regional center, the school district for early intervention services, but they can also connect to various different family support services that they have on site, support groups, parent education groups, case management. So I think that that's helpful to know in San Francisco as a good possible starting point. Also wanted to take this time to demystify a little bit about our family resource centers for pediatricians. Sometimes because we have so many, we have 26, it can sort of be a head scratcher about where to start from. But I do want to just say again that our family resource centers operate in such a way that you should be able to find a standard set of services once you're there. And we've also funded them in a way that they have a geographic area of focus and also a population area of focus. For example, teen parents, parents of children with special needs, LGBTQ parents. And so we have all of that on our website to be able to navigate by geographic area, by special population, language, cultural expertise. So that's a good way to utilize our website to search. And if you are stuck, then I would say Help Me Grow or Safe and Sound's talk line. We also have, we fund an API specific stress line. So those phone lines and talk lines are a really good place to go if you are stuck. And just one last note about our family resource centers is that even though First 5 is birth to 5, our family resource centers are birth to 8 on up. So really family resource centers, because they're joint funded with a variety of other city departments, they will help with that broader age range. And all of our centers are operating. So early care and education, family resource centers, all have made that switch to virtual modalities with all of their services. And our city funded early care and education centers, 100% of them are open. So really important to know in this time that our city funded services continue to operate and function.
Thank you, Teresa. And Artanisha, let's come to you. Can you tell us about Find Connect and how that amazing technology helps us connect to this complex system?
Yes, my apologies for the audio. If you're having any issues, please let me know. I try to move locations. So Find Connect, there are just a couple points that I do want to make about Find Connect. Is a program that was established at Children's Hospital in Oakland in our FQHC. And we have taken that model and have shared it externally, both virtually and in person. And so you can use Find Connect in a number of different ways, get connected to Find Connect in a number of different ways. And so our families are referred to Find Connect by the providers initially. And once the providers make the referral, the families are connected to a navigator. This navigator will then follow the family for an extended period of time, maybe just, for a short period of time, depending on the needs of the family. And so everything is really tailored to the needs of the family. And so if a family only needs one thing, and that'd be like diapers or something of that nature, the navigators could potentially close that case right away. If there's a family with more complicated needs, then they will work with that family, following up with them on a regular basis, and then helping them to navigate any barriers they may be experiencing. And that could look different for different families. But the standard is that families are connected with a navigator on a either weekly or bi-weekly basis, and they are able to stay with that navigator for a minimum of 6 months, depending on the need. That is our internal model. Oh, I'm sorry. And then also our navigators are recruiting families while they're waiting. So things are a little bit different because of the pandemic, but for those families who do come to the clinic still for in-person visits, the navigators are still working directly with those families. And then we have a virtual navigation hub where families are being referred to Find Connect through their providers. And then we have a navigator, a community health worker who's working with those families in the same manner, but over the phone, using technology, cell phones, internet, email, things like that. And the way that you could get connected or use Find Connect outside of Children's Hospital Oakland is either through our CFMG network partnership, or you can license Find Connect. And so right now we are piloting a study where, and it just so happens that we were already doing this prior to COVID. And so it was just perfect timing, and it just kind of worked out and made a lot of sense to sort of pilot and understand how virtual navigation works, what the benefits are in our current times. And so families are referred by the providers in the same way. The providers are using the PROS tool to screen families for any needs. And depending on that score, if they score, I think it's anything over a 1, they are referred to Find Connect if they're interested. And those navigators work with the family in the same way. They're instructed to follow up with the families on a regular basis, to support them with navigating any barriers, whether that be filling out applications, making phone calls or whatnot, and really, getting creative to to find ways to support families. The other way, what I mentioned, is licensing Find Connect. So if you're not connected through our through BCHO or through our CFMG network partnership, then you could also license Find Connect. And some of you probably already have, case managers or folks who are doing this work, but you could use this tool to sort of build capacity for your families in your clinic or in your agency. And you would do that by entering into a licensing agreement with us. There are some fees attached to it, but you would get your own personalized instance of Find Connect and be able to track your patients in real time, get that live data, and use that tool to build capacity within your own settings.
So that's amazing. There's a bunch of questions about Find Connect that probably we can take back on email, but around, how do you fund the navigators and so forth. But I think the underlying it is this.
Can I say one more?
Yeah, please.
I just want to say one more thing before you moved on. Just the last piece is our community-based, the resources that we use. These are actually existing resources in the community. We haven't created anything new. We don't own these resources, but what we do is take the extra step to vet those resources. And so when we populate them into our knowledge base, is what we call it, our data bank of resources. We are reviewing those resources on a regular basis, and more than one person is reviewing those resources depending on the type of resource it is. So if it's a federal resource, it expires and someone is looking at it, at least 2 people are going to review that. Go to the website, call the agency, sometimes even visiting agencies to update those resources. And so we're updating them either on an annual, a 6-month, or a seasonal basis, depending on the type of the resource. And so that is one of the things that I think is really helpful, where we know that our resources, it exists, and our families are getting their needs met, and we can provide feedback. There's a feedback loop to, communicate with families about what their experiences are and closing the loops on those resources.
If I understand it, I wanted to say, Artanisha, there's sort of 2 models. There's the system out there that everybody else is talking to, and you're speaking to social worker, building the system internal to the practice with Find Connect and navigators, so that we can navigate a complex system more better for these families. Is that a way of understanding how the Find Connect and the navigators work together?
Essentially, yes. We're just connecting families to resources, and this technology tool is building that capacity.
Incredible. Thank you. I know, Joan, we just have 30 seconds left. Do you want me to turn it over to you to tell me some of the questions? And I want to thank the panel members. And
Yes, thank you so much to all of you for your insight into navigating as Dr. Epstein said, is a very complex system. And thank you for all the great work that you do for our children and families. Really do appreciate it. I'm afraid we actually are out of time. So we do have a half-hour lunch break scheduled for right now. So please do come back promptly by 12:45. We'll have a great presentation from Dr. Petra Steinbushel about using a stepped care model to address the impact of COVID-related change. So please come back half an hour.
Can I just say one thing to everybody? Thank you so much to the panelists and so much gratitude for what you do. You're saving lives. I appreciate what you do every day.
Wonderful. Thank you.